Hey guys, how you doing? Okay, so we're gonna go through another lecture here. We're moving on to chapter 29 now. We're gonna talk burns. We're gonna have to learn some things about, excuse me, sorry, learn some things about the rule of nines, the Palm method of identifying the amount of burn, levels of burns, first, second, third degree burns, how you identify that kind of stuff. Layers of skin. Okay, so we have three layers. There's actually more than just that in that top layer, but these are the three layers of skin we need to understand. You guys will go a little deeper into this. The epidermis, the dermis, and subcutaneous layer. Now, the epidermis is what you see on the outside. It's all dead. It's hardened keratinized cells that are meant to protect us, and they do protect us in certain ways. The dermis is the largest portion of the skin. It's actually alive, got all the blood vessels, nerve endings, sweat glands, everything happening inside here. It's all live cells reproducing constantly. And then you have the subcutaneous layer, which is the fatty layer, which is actually not true skin. It's an anchor of skin to muscle. So it's that, and it's cushioning between. So it's the third layer of skin, which is not true skin, but nonetheless, we have it there. And it's important to understand in burns. We'll talk about it. Function of skin: provide a physical barrier against the external environment, provide a barrier against infection, provides protection from bacteria and other harmful agents, coronavirus, insulates and protects underlying structures and body organs from injury. There is some cushioning involved here. There is some keeping it from drying out from the environment, and overall, just it's a layer of protection to your abdominal organs, specifically inside muscle and all that kind of stuff. Aids in regulation of body temperature, provides for sensation, transmission, hot, cold, pain, and touch. Aids in elimination of some of your body's waste through sweating and secretion. Contains fluid necessary to function for the function of other organs and systems. Most burn patients who die in pre-hospital settings die from an occluded airway, toxic inhalation, or other traumas. So when we're talking about these types of burns, the most common deaths here are those occluded airways from toxic inhalation. Smoke inhalation burns that interior of your chest into the lungs. We get fluid buildup, and there's nothing we can really do about it. Maintain a patient airway, adequate ventilation, oxygenation, and control life-threatening bleeds are what we would need to do in these situations. Circulatory system. Burn injuries can cause extreme fluid loss. The body's job to put out a fire. You talk about a firefighter, how do they put out fire? They use water. How does a body help cool a burn? Adds water. So you're going to lose fluid in the long run. You're going to become dehydrated very quickly in a burn. Burn increases capillary permeability, which increases intravascular fluids. So you're going to leak these fluids out. Edema can further compromise tissue perfusion, constricting blood vessels, tightening things up, and not allowing them to actually perform properly. Circulatory system burn shock. Burn shock can develop after a few hours. Vascular damage allows leakage of fluids and proteins from the vessels, and fluid shift results in hypovolemia. Respiratory. Burns and inhalation of superheated air can cause obstructions of the airway. Smoke and toxic gas inhalation can cause respiratory compromise and poisonings. Circumferential chest burns can impair ventilation. So as you get burns around your chest, and we talked about this in CPR, when we're doing the AED, I think I mentioned if a female has the bra on, we have to take the bra off because that burn, that electrocution will go around the circumference of the chest, which will burn the tissue, which will keep you from being able to expand and contract the chest properly. So that's what we're discussing in this spot. Renal system decreases blood flow to the kidneys, reduces urine output. The kidneys must handle an increased amount of waste product for cells destruction, and kidney failure may occur. Nerves and muscular systems, nerve endings are destroyed, loss of function of extremities. So in these burns, we can lose the ability to move your extremities. Tissue begins to tighten up, get stiff. It's not elastic, it loses its elasticity, and things can't move properly anymore. Gastrointestinal system: decreased GI performance can cause nausea, vomiting. Long-term considerations include ulcers and ensuring adequate nutritional support. So during the end of this one, I know it's pretty short, but I'm going to do something a little bit different this time. I'm going to actually assign a couple of research things I'd like for you to go through. And I'm going to assign this per group of 5 that I see on Tuesday and that I see on Thursday. And when we show up, I'm going to have you guys report out on what you actually found. So I'm going to assign specific ones to specific people. Okay. That's the idea for Tuesday and Thursday. Thank you for listening, and hope everything's going well with you guys.